Every 40 seconds, someone in the United States has a heart attack.
Yeah, chest pain can be a key warning sign of heart trouble, but millions of people who suffer chest pain are actually suffering from something else. Dr. Frank McGeorge is here with a closer look at other potential causes, Doc.
Well, you know, Kim and Evan, I see a lot of chest pain in the ER. And in fact, in the majority of cases, we ultimately discover a non-cardiac cause. But that does not mean the chest pain should be ignored.
Chest pain is very common. It accounts for about 5% of ER presentations in the US. And most of the time, chest pain is not heart-related.
One of the most common other causes is heartburn due to gastroesophageal reflux disease, or GERD. Dr. Nicole Bave, a cardiologist at U of M Health, says the body may not know where to place the pain in the esophagus and stomach, which then gets referred to the center of the chest.
Spasm of the esophagus, for instance, which is something that can be associated with acid reflux disease, can be really, really painful.
Straining the chest muscles can also lead to pain.
There are a lot of bones and muscles in the chest wall, and particularly if you've done a strenuous workout or a lot of heavy lifting, that can lead to strain of those muscles. Similarly, if you've been coughing because of a respiratory illness, that can cause strain on those muscles and cause chest discomfort as well.
Emotional stress or anxiety can trigger chest pain as well.
There's a very powerful connection between the mind and the body. Oftentimes, mental stress, anxiety, and depression will manifest as physical symptoms.
Bave says if there is any doubt, get checked out.
If you have chest pain, particularly if it's new, severe, or associated with other symptoms, like, again, that shortness of breath or nausea, those are reasons that you want to go into the emergency room.
Now, I really want to stress, unless there is a clear other cause for your chest pain, you do need to take it seriously and seek help. And if you have risk factors for a heart attack like diabetes or high blood pressure, that actually increases the likelihood that your chest pain is heart-related.
I was going to assume as an ER doctor you would never say, yeah, just let it'll pass. Right. When you feel chest pain, you probably just can't ignore it.
Yeah, generally speaking, I'm going to be the one that's going to say take your chest pain seriously. Yeah. And I know in a strange way it's frustrating for patients when we ultimately come up with something like acid reflux or stress as a preliminary diagnosis. But the consequences of ignoring something like chest pain is just too high if it is your heart. So we do have to take these symptoms very seriously.
It's frustrating. People would rather have the heart attack?
You know, it's strange. People want something more definitive, and unfortunately, if we don't find something like a heart attack, we end up with a preliminary diagnosis, and it's just not as satisfying as finding an actual diagnosis. Sure. They're strangely less relieved than you would think.
It's crazy, isn't it? Yeah. All right, Doc.